Welcome to part 3 of this 3-part series on weight loss. Today, I'm going to talk about the do's and don'ts for running a weight loss practice. The objectives for today are to discuss how to successfully set up a weight loss practice, how to fast track so you can see patients immediately, and how to avoid common pitfalls. So the first thing when really thinking about incorporating weight loss into your business is thinking about the types of patients that you see. What are their demographics? What are they looking for? Are they more on the scale of a sicker patient, or are they someone that's really looking to improve their overall health and they're in a pretty healthy state already? So these are important things to think about. What programs are you going to offer? Who is on your team and what role will they play? How will you train your team? Where will you get the resources? So the handouts, the assessment forms, all of the things that come into creating a business in itself, and specifically weight loss, there's just a lot of details. So really thinking about that is very important, as well as how will you market your business. So just to talk a little bit about the programs, you definitely want to stick to 1 to 3 programs to start. You don't want to overcomplicate it. You want to get really good at what you offer, and then you can expand from there. You definitely don't want to offer the same programs that offer short-term results. So I'm referring to all of the diets and all of the meal plans, all of the different fad diets that are out there that people continue to try and they continue to fail because they gain the weight back immediately. We really dig deep into strategic weight loss, and we want to start changing. We want to change the statistics. We want to start seeing the trends of healthier people go up. Offer programs that are safe and effective. This is obviously a priority, because at the end of the day, it doesn't matter how effective it is, it has to be very safe. Lastly is you must have protocols in place. I am going to talk more about that, but that is, something that we have learned over the years, and that is why we talk to other people about it now. And just briefly, the benefits of protocols are to outline what is done at each visit. So every time you see a patient, what are you going to be doing at that particular visit? It provides consistency of care and messaging to the patient. It improves new employee training, and overall it improves outcomes. So again, you want to identify your team. Who is your team? Is there a doctor, RN, NPs, medical assistants, your office admin or office manager? Do you have a nutrition specialist or a dietitian? So these are all things to kind of think about as you're developing your programs. And then really digging deeper into the responsibility of each team player. Who's going to do the initial consults? Because that's, one of the most important pieces to obviously bringing your patients in. Who is doing the medical assessments and what are they doing? Who's taking photos? Who's educating the patient on the program? Who's doing the follow-ups, and who's taking inventory and ordering product? You will also have to put together the forms that you're going to be providing. So most practices already have some type of intake form. So this is very driven more toward nutrition and of course, medical assessments. You are going to have certain consents that patients will need to fill out, and model consents as well, because in order to really advertise and market your business, you want to show the success of patients. So really taking before and afters is extremely important. So now we're going to talk about avoiding certain pitfalls. And again, we have learned all of these things in the last 6 years, and that's why we've pulled everything together. And what I noticed as a business owner is there was a lot of mixed messaging going back and forth. So patient would come in and they would see, say one of my employees one day, and then the following week they'd see someone else, and they were getting different information. So there wasn't consistency. There was some confusion that was happening when communicating with the patients. So these are things that we learn and now we teach. So lack of education and educational handouts. It's so important that patients understand and be in the process and understand, why they are doing what you're asking them to do. Staff that is not properly changed you will lose patients almost immediately. The weight loss industry and people who are overweight, it's very difficult for them to make that first phone call. They come in, they don't feel great. They're ashamed. They wish they didn't need to be there. And so they're looking immediately if they can connect with your business and the employees that are basically seeing them. So making sure that they know what they're talking about, they know what options are available for patients is so important. Don't offer programs, again, that don't work. People are not looking for you to put them on a specific meal plan and just to count calories, because counting calories or just reducing calories is again, it's short term. I don't need to talk further about that. We all know that it's for the most part a short-term solution. Another pitfall is not setting timeframes and expectations for visits. And this goes for your employees and for patients. Everybody should understand what is happening at the visit. How long is the visit? Because as you can imagine, this could get, you lose that process and it will logistically affect your business if everything is not laid out properly. So I want to talk just a little bit about Weight Loss MD Pro. So I opened Weight Loss MD and Wellness in 2014, and weight loss is all that we do. We've been specializing in weight loss. All we do is study new updated research that comes out. We've done a couple studies of our own and essentially started creating protocols to perfect every detail along the way. So again, 2014 we opened. In 2016 we started developing protocols for all of our programs, for all of our provider training. And in 2019 we launched Weight Loss MD Pro, which is now our business to business. Now we help other businesses incorporate weight loss. So we essentially have been on a mission, and that is an understatement. There is no doubt about that. But we really the main purpose was to improve efficiencies in our clinic. We needed to improve training for our practitioners. We wanted to break down each visit and outline what is to be done at each visit so the patient gets a similar experience. We wanted to ensure the consistency of messaging in teachings to patients. I'm going to move this. And we wanted to ensure success when following the protocols. So now we have developed our medical weight loss training for providers. And this is essentially what we have launched a couple years ago. And each year it gets better and better because obviously, this is a massive industry and there's so much opportunity to help people. So in addition to the provider side and the provider training that we offer, and I know that we talked about it in the part 2 series of the videos, we also have an automation, an ability to scale your patients. So you can scale your practice without adding, additional staff members, additional resources. So this is the patient experience that they get, and they can get set up on our program, which again, they are still your patient and you have minimal work that you have to do and you still get paid from the patient. So this is what we have essentially created in our platform. So just to summarize, Weight Loss MD Pro is the first and only weight loss provider training program that is out there today. It is 100% virtual, and we have it set up so you can essentially start seeing patients in 30 days or less. Everything is completed for you. Protocols, handouts, consents, videos, And we are constantly updating the information. It's what we do all day, every day, and you have access to all of that information. Like I said, it is now scalable, because if you have physical clinics, you can only imagine that there's a lot of work involved in physical clinics. So now you have an opportunity to build without all of the necessary means within the scope of your practice. And then after a patient completes a program, because the way that we have it set up is every patient or new patient would go through the program first with your practice, and then you have the option to automate them, and they go through our online program. But what we also offer to you is an actual virtual dietitian support service. So our platform is set up so you do not need a dietitian. This is set up so any practitioner is able to execute weight loss within your clinic. So that is it. That is the summary. And if you are interested in having a more personal consultation, you can email me. You can see here at cstoka@weightlossmd.com. You can also call the number here. And I would love to talk to you more about your business and see how we might be able to help you grow and expand. Thank you so much.